Alright guys, so I told you I was going to do a review of more or less my advanced first aid kit stuff that I've made the choice to have in my kit. Before I go over this stuff, I just want to give a little disclaimer that I'm not endorsing any of this stuff. Some of these things are advanced level things that require additional training to know how to do. But at the same time, I'm not going to go off on a soapbox about telling you not to have them and that you're not qualified. Some people do that on the YouTube videos. My only thing is that as long as you don't take away from this that I'm encouraging you to have this in your kits, then I'm perfectly fine talking about it. I don't have any medications in here. This is just strictly my basic stuff / advanced stuff. Again, based on things that I've chosen I want to have. Any of this stuff you can actually purchase on eBay or Amazon. Some of the IV supplies we'll talk about later. If you try to purchase through a company, you're going to have to show that you have a medical license and things like that. But actually, you can purchase some of these things from eBay. So with that said, let's just go ahead and start talking about this. Top drawer here, I've got like bandaging supplies. If you've seen my other video about my other basic kit, kind of what I encourage for people to have. A lot of it is bandaging equipment. Up here I have just tape, different types of Coban, I have an ace bandage, and then I have this gauze, rolled gauze for securing bandages. Here I have in this little pocket here, I've got just medical grade Vaseline, petroleum jelly, a little more tape just because I have the room for it. And then I've got lots and lots of Band-Aids and alcohol preps. Tiny little Band-Aids, some butterfly bandages in the bottom here, and then just some like athletic tape, again just to secure, like if you're putting like a bulky dressing type of a thing on. This is my top drawer stuff because it's the most common things that, at least for our family, that I find that we use. Having little kids, we use Band-Aids all the time, and so if you're going to clean it and then put a Band-Aid, it's top drawer, easily accessible. It's right here, the foremost of what I have. So that's why I chose the top row to have this stuff. The next row down, I have some diagnostic equipment and again some more bandaging supplies. I've got some obviously non-sterile gauze here, like some 4x4s and some cotton swabs, 2x2s, and then I have sterile versions of all of those. 2x2s here, some 4x4s. And then underneath those, I also have, if you've seen my other video, I talked about some of the Tegaderm and what those are good and what those are used for or what they're good for. And I have some larger versions of them down here. Here I have a pulse oximeter. Again, I kind of talked about it in my other video. I mentioned in that video, if you'd like to see any videos on a little more detail on some of these diagnostic tools or how to use them, I'd be happy to do so. Just let me know in the comments down below if you'd like to see something like that. But I do have a pulse oximeter here. In the center here, I've got, again, an older style thermometer. I have a digital thermometer, a couple pen lights, and a pair of scissors. Over here, I have a stethoscope, a blood pressure cuff, and then down the bottom I have a pair of trauma shears. And that's that tray. So now as we move into like more advanced stuff that, again, you may not feel comfortable having in your kit. That's not up to me, it's up to you. But this is what I've chose to have in my kit. This is basically my IV supply, or at least my IV start stuff. I have tourniquets over here. I have different IV catheters here. I've got some 20 gauges, 18s. Let's see, 16s down here. I think I even have, yeah, I have some 14s on the bottom over there. Up here I just have some needles for if I had some medications to administer intramuscularly, then these are good needles to do that. The 25 gauge needle. So I have some of those up here, and I have some more over here and some syringes. Over here I have all my flushes. I've got a 1 cc syringe with a needle on the end. And here I've got my larger catheters. This is an ARS needle. I can talk about that in another video if you'd like, when I talk about some more of the diagnostic stuff if you want me to. This is by North American Rescue. It's designed for needle decompression. It's a really neat needle. So I have that here along with some 12 gauge needles. And then down on the bottom here I have a lot of things. So I'm going to go ahead and scoot this back and then open some of these things. So I'm going to set this aside. I'll talk about that in a minute. Obviously every kit needs to have gloves. And so I have quite the supply of gloves here. Down here I have a glucometer. So you can check blood sugars. So here I have intubation equipment. If you don't know what intubation is or what this stuff is used for, look up some videos on YouTube. There's some really neat videos on what intubation is and how to perform the procedure. Again, if you don't know how to do this, I don't recommend having this in your kit. This isn't something that I would use on anybody. This is just strictly like my very close friends or my family. If something ever happened, then that's a decision I've made personally. I'm not saying it's right and I'm not saying it's wrong. Just this is why I have it here. But this is a Miller laryngoscope set. There's straight blades. I've got some extra batteries in here. With that, I have some advanced airway supplies. So I have this here. This is to secure an advanced airway, or even a BLS airway, like a King airway or a combi tube or something like that, an LMA. This is the Thomas tube holder. So this is good to have. I have a couple of bougies, which can assist you with intubation and things like that. So I have some of those. I have one King airway. Now I've had this for a while. I would like to purchase a couple more of different sizes. Obviously, as you see, this one's not in a package, so more or less this is just in here because I have it. I definitely wouldn't use this in a non-sterile, like it is non-sterile on somebody. This is just because I have it. So with that, I have a large syringe in order to blow up the balloons on that. And then here I just have an assortment of different size ET tubes. I have a pediatric stylet that goes in the endotracheal tube, and then I have a bunch of endotracheal tubes. So this one here is a 2.5. I have from 2.5 all the way up to an 8. Some of them have stylets already in them. Some of them don't. So anyway, that's what's in this kit, endotracheal tubes and the things I've just shown you. This black bag here on the outside, I have a small pair of scissors here, and then I have a couple different sizes and types of hemostats. I have a curved hemostat and then some straighter ones. This one doesn't have any grips. This has got grips on the inside. So I have those on the exterior pocket here. And the reason I have that is because I would use those like for a cricothyrotomy or something like that. This is kind of what this kit is a couple of really advanced stuff. So you can laugh at the end of the video because now I have a Band-Aid on, so you can find out what that is if you watched all the way through the video. There'll be a blooper at the end. So in here I have some oral airways, OPAs, oral pharyngeal airways. I have one NPA or a nasopharyngeal airway, a couple packets of lubricant to put in one of those NPAs. Then here I have an IO needle. This goes into the bone if you can't get an IV. It's called the Illinois sternal/iliac aspiration needle. Some people know it as the Jamshidi, but again, hate to keep saying this, but this is just stuff that I don't recommend. I don't endorse you having. Just stuff that I've decided I would like to have in my personal kit. Again, for my family or for close friends that if in the event that they would need it, then I would have the supplies to do it. So I have one of those, and then I have let's see here, what do I have in here? I have an abundance of scalpels in here just that I've collected over the years, and I had nowhere else to put them. So this is in my Crike kit. So scalpels, my hemostats, and then an appropriate endotracheal tube to perform a surgical cricothyrotomy. So I have that all here in this kit. All right, moving right along, I've got the rest of the IV supplies here. So I've got a 250 bag of normal saline. I have a liter bag of normal saline. I have a 10 drop IV administration set. And then, oh, they're both 10 drops. I thought one was 15. So 2 10 drop sets. Here I have a Broslow tape. If you don't know what this is, it's a pediatric guide for emergency responders. Actually, hospitals use them too. But you can measure by the length of a child. As you can see here, it's color-coded. And then it tells you, based on the child's length, so if you measure, it says here, measure from this end. So let's say you pick the head and you measure out, and let's say the child is in the pink. Their feet rest or end in the pink. So that tells you that this child's approximately 6 to 7 kilograms. So it has on here different types of resuscitation drugs and the dosages for RSI or paralyzed induced intubation, that kind of things. And then other medications for seizures, overdoses, fluids, and then what kind of equipment sizes you'd need like endotracheal tube size, the type of laryngoscope, and just things like that. So I keep that in here. Moving right along, the last few things I have in here, a couple of IV start kits. It includes a tourniquet, alcohol, betadine, some tape, and then an occlusive dressing to put over the IV site. And then I have extension sets. So some services use these, some don't. If you start an IV, when you leave the catheter in the vein, you can hook the IV tubing up to it and then administer the fluids that way. Or you can put one of these on, and it creates a closed circuit. So this would attach to your catheter, and then your drip tubing, your IV administration tubing, you could hook into here. And that makes it a closed system, so when this runs dry, you can disconnect it, and then they're not bleeding. It's a closed system. It's all right here. So that's called an extension set, so I have a number of these in here. And then the last thing I have is a BVM. I mentioned in my other video, I don't have pediatric masks. I'm in the process of getting those right now, because I have mentioned I have small children at the house here, so I only at this time have an adult mask. You can kind of fiddle with that to make it work, but like I said, I am going to get some pediatric masks. And then I have oxygen tubing to hook up to the BVM if I had an oxygen supply. I don't right now. But in the event that you use this and an ambulance showed up or the fire department, then you could hook this into their oxygen supply. But this kit right now, how this is set up, this is how I keep it here at the house. Again, I've got my basic bandaging stuff up on the top rack. I've got a little more bandaging things on the second, and then my diagnostic stuff. You can't see that very well here, but again, my diagnostic stuff. So this is all how I would have it here at the house. I definitely wouldn't have any IV supplies in my car kit. So like I said, I'll upload that video once I get that kit ready to go and everything. So I appreciate you watching this video. I hope I didn't talk too much. I have a tendency of doing that. Give me a thumbs up, subscribe if you haven't already. I appreciate all the views that I get. Leave me a comment down below if you have any questions, concerns, or anything else that you'd like to send to me. I look forward to doing another video for you guys to watch. Again, thanks for watching, and I'll see you next time. We're going to go ahead and stop that, since I've just lacerated my hand on a pair of open scissors. Is that still in there?
What?
You're still recording, right?
Yeah.
Yeah, so let's put that in there.